Hey, Jim Hoffman here for EMS SEO and another episode of the EMS Green Room. Just stay calm and nobody is going to get hurt. Well, what I mean by that, you ever notice that when you get a call that's serious, maybe a cardiac arrest or a major trauma patient, excitement levels by families, patients, and even EMS providers go up and the quality of care can often go down. Particularly when you think about cardiac arrest calls, that real life and death of EMS. Well, I guess that also depends upon who you talk to and what articles you read and even your own personal stance on it. But the thing is, the two things that matter the most to successfully resuscitate someone in cardiac arrest is what? CPR and electricity. Yes, I went and said that, and I'm a paramedic with all my drugs and interventions available to me, but quality CPR that's uninterrupted with appropriate defibrillation are really the two key things that improve success rates. Yet we keep transporting these patients, lights and sirens blazing, with longboards getting thrown around, stretchers rolling in driveways, and equipment being balanced every which way to and from the ambulance, giving not so good quality of CPR in the process or even in the back of the ambulance with plenty of interruptions, decreasing those chances of a successful resuscitation. Not to mention the danger it puts crews and the public in by us driving around in emergency mode and in my opinion, kind of the false hope you give the family when you start taking those patients to the hospital, right? Maybe I'm being a little bit dramatic, but I don't think the ED is going to do CPR any special way or defibrillate any differently than we do in the field. Plus, even if we do intubate and give medications and other interventions, I'm pretty sure the ED doesn't have some kind of magic epi that they're going to be giving the patient. More and more EMS protocols are being written to treat cardiac arrest patients at the scene, consult with medical control, and then as a general rule, end up pronouncing them at the scene. Yet I still see resistance to this by none other than who? EMS providers, who think that transporting them to the emergency room is going to somehow revive them. And I've seen this argument over and over again, especially in social media, Maybe they don't want this change going on because now they're going to have to be the ones to, confront the family and tell them their loved one is dead and there's nothing that can be done. Maybe it's because they fear those legends of patients waking up 2 hours after being pronounced. Or maybe, it could be something we've talked about a lot of times. It's because transporting them lets them do something when there's really nothing else left to do. Listen, I think EMS should be embracing these changes, understanding why they are coming about, and educating themselves about it. This is part of our job, right? Understanding all this stuff and doing these sort of changes that are based on research, and it's also things just like those drunks or the cut finger or even being mandated for overtime. It's all part of the job. And as professionals, we have to act the part, professional. And as medical providers, we have to understand and acknowledge what is best for the patient, no matter what state they're in. Having that desire to help, right, that's something that is key to EMS, and I think is in all of our blood as EMS providers. And as professionals, we want to be able to help people. But knowing the right thing to do is really vital in today's healthcare environment, and transporting a body to the ED so that somebody else can tell you there's no pulse is not the right thing for anyone. So I'm wondering, what do your guidelines say on transporting cardiac arrest patients? Have they changed to treat and terminate on scene? And have you seen any resistance to it by your peers, by management, or even by yourself? Let me know. I'd love to hear your story. Put your comment right here in the show notes. It would be great. You can send me an email even. My email is jhoff@emsseo.com. I'm also going to put a pretty cool article I'd love you to read about this over at roguemedic.com. I'm not sure if you've ever heard of roguemedic.com before. He's got some great articles there. This one is based on evidence that interrupting chest compression kills patients. Go check out the article. I'm going to put a link to that in the show notes. Until then, guys, until next time, as always, I'm Jim Hoffman for the EMS Green Room. Stay safe.